Here is the anterior abdominal wall. This anterior abdominal wall is composed of different types of the muscle, and these muscles named according to the direction of the muscle. This is a muscle that is oblique muscle, and here is another muscle, it is also oblique muscle. So this oblique muscle is external, so this is known as the external oblique, and this oblique muscle is internal to this external oblique, so this is known as the internal oblique. There are other muscles in this anterior abdominal wall, that is, this is the transverse muscle, so this is the transversus abdominis, and this muscle is very straight, so this is known as the rectus abdominis. These four muscles form the anterior abdominal wall. Here is the external oblique muscle. This external oblique muscle originate from the lower ribs, lower 8 ribs, through the fleshy slits. Here we can see there is one slip, there is another slip. The upper 4 slips of this external oblique, here we see the slips of the external oblique, they are interdigit within the serratus anterior muscle. Here we see the serratus anterior muscle. In between there is the fleshy slip of the external oblique, 1, 2, 3 and the 4, and the lower 4 fleshy slips of external oblique muscle arises from the latissimus dorsi muscle. Here we see the lower 4 interdigits. It is not clear in this part. This external oblique finally directed downward, forward and medially, and in this part of this body this muscle is replaced with this aponeurosis. Here we see that the muscle is in the lateral side and the aponeurosis in the medial side, and finally this aponeurosis is inserted in this xiphoid process. In this midline there is a white line, this is known as the linea alba, and in this part this is the pubis bone, and here is the pubic crest. And the insertion of this part is in the xiphoid process, linea alba and the pubic crest, and in this lower part, in this lateral part, the external oblique muscle is inserted in this outer leaf of the iliac crest. So this is the origin and insertion of the external oblique muscle. This external oblique muscle has contribution, and in this part of this body, the external oblique forms the inguinal ligament from the anterior suprailiac spine to the pubic crest. There is the infolding of this external oblique aponeurosis forming the inguinal ligament. We will learn it later. And in this part of this aponeurosis of the external oblique, they form the anterior wall of the rectus sheath, and we will learn it later, the rectus sheath. Now the internal oblique muscle. Here we see the internal oblique muscle, and the internal oblique muscle also has a muscular part in the lateral side and the aponeurotic part in the medial side, but the direction of this internal oblique is opposite to the external oblique. The external oblique muscle is downward and medially, here it is upward and medially, and the origin of this internal oblique muscle is from the iliac crest. Here we see this is the iliac crest, and iliac crest has a outer line or lamina, intermediate line, and the inner line or inner lip. The outer line or the outer lamina of the iliac crest, outer lip of the iliac crest, the insertion of the external oblique aponeurosis, external oblique muscle, and the intermediate lip of the iliac crest, there is the origin of the internal oblique muscle. And from the here we see the inguinal ligament and the lateral two-third of the inguinal ligament, the origin of the internal oblique, and the thoracolumbar fascia. From this part of the body, the internal oblique muscle originate. Finally, they passes upward and medially and forward, and they insert in this linea alba. In this linea alba, pubic crest, and the xiphoid process, and the costal cartilage. Here we see this is the sixth costal cartilage. This is the seventh, eighth, ninth, 10th. In this part of the costal margin, the internal oblique muscle is inserted, and some fiber of the internal oblique muscle also inserted in this rib. In this rib, 9th, 10th, and 11th. So the insertion of the internal oblique muscle in the lower ribs, xiphoid process, linea alba, pubic crest. These are the insertion of this internal oblique muscle, and the muscle is the Transversus abdominis. Here we see the transversus abdominis muscle. This muscle has also origin from the inguinal ligament, lateral one-third, and in the iliac crest there is the inner lip. From the inner lip, so outer lip is the external oblique, intermediate lip is the internal oblique, and inner lip is the transversus abdominis, and the thoracolumbar fascia, and the lower ribs. This is the origin of the transversus abdominis. Finally, this muscle insert in the xiphoid process, linea alba, and the pubic crest. In this aponeurotic part of this transversus abdominis, we see there is a gap in between the symphysis pubis and the umbilicus. Here there is a gap. This gap, the upper border of this gap, that means lower border of this part, is known as the arcuate line. We will learn it later when we will learn the rectus sheath. And there is another muscle in the abdomen, that is the straight muscle, that is known as the rectus abdominis. It originates in this pubic crest from two tendinous origin. There is medial and there is lateral. After originating in this part, this muscle passes upward, and finally they insert in this cartilage, costal cartilage. So what is the number of this costal cartilage? Can you count this costal cartilage? We know that this is the free side of this costal cartilages. Here we see there is a costal cartilage that is separately inserted in this, attached with this sternum. So this will be the sixth costal cartilage. This will be the fifth. So the rectus abdominis muscle is inserted in this fifth, sixth, and seventh costal cartilage, and also in this xiphoid process and sternum. So this is the rectus abdominis muscle. This rectus abdominis muscle has some tendinous insertions. Here we see one tendinous insertion. There is another. There is another. There is three prominent tendinous insertions, and the bodybuilder has can show these tendinous insertions more prominently. There is a pack, so there will be the three packs in each side. We will see the image of this thing, and there is ill-defined another tendinous insertions in the below the umbilicus. So these tendinous insertions, the lower one is at the level of the umbilicus, the upper one is at the level of the xiphoid process, and middle one is in between two. So this is the rectus abdominis muscle. This rectus abdominis muscle is remain within the rectus sheath.